Okay. Thank you so much for joining us today. And it's going to be really brief. We basically want to touch on what you're doing right now to address the pandemic in your district.
So a number of things. First, on March 16th, the legislature met and appropriated up to $1 billion of emergency funding that's being handled by the governor's office. It's going towards buying medical supplies, buying more ventilators, augmenting and increasing our hospital capacity in certain areas of the state, including the 35th Assembly District, San Luis Obispo County, Northern Santa Barbara County. Even in good times, we don't have enough hospital beds or ICU beds. We don't necessarily have enough ventilators. So, and we need, of course, a giant ramp up in personal protective equipment so that our frontline healthcare workers have the masks and the goggles and the gloves and the gowns that they need to keep themselves safe while they're taking care of people that contract the virus. So that was our first thing that we've done. We worked with the Alcohol Beverage Commission to loosen some of the regulations on an emergency basis so that even though wineries have their tasting rooms shut down, they can still sell a curbside pickup type arrangement. We worked with Department of Public Health to loosen some of the regulations on hospitals so they can set up triage tents outside emergency rooms so they can test people that come in that may be symptomatic for COVID-19 or people that have the flu or what have you, and triage them into the right place. And then we've been working very hard just on constituent services, helping people file for unemployment if they've been laid off because of this, helping small businesses apply for the SBA loans that the federal government has now funded to the tune of $350 billion, helping people with their normal issues with DMV and so on and so forth. So, we're seeing a health crisis first and foremost. We're going to get through that. I think the worst is still to come for us locally, but we are steadily increasing our medical supply and our healthcare supply. We've got over 250 retired healthcare workers that are going to come back and help out to handle the surge. And then when we get through that, we need to, at the same time, we need to be addressing the economic crisis that a lot of people are facing because of business closures and a slowdown of the economy. And I think we're making strides on both fronts. And my hope is that by this summer, life will generally have gone back to normal and we can start making up for lost time.
That's our hope too, generally across the board. So you mentioned 250 healthcare workers that are retired and are coming back to the workforce. Where will they be placed? Are they going to be placed in existing healthcare facilities, or are there alternative healthcare facilities that you're looking at?
Both. We are trying as hard as we can to get some FEMA disaster funds sent to the state and then down to locals so that we can set up mobile hospitals. We're also in San Luis Obispo County proceeding with alternative care facility at the Cal Poly campus. Obviously, the school's not in session right now. They've gone to remote learning. So they've got a lot of buildings and facilities that I think would work very well with on-site food delivery, with on-site laundry. So that's something that San Luis County is moving forward to set up. So we're sort of all hands on deck. We're getting as much as we can deployed as quickly as we can. And I'm talking to the director of Office of Emergency Services at the state level, either himself directly or one of his staffers, basically every day, to try to press the urgent need for us here on the Central Coast, because we're frankly very far away from the major urban centers and we don't have the hospital capacity yet that we think we need to handle the surge.
And when you're talking about the funding coming down from the state and that being put towards, the shortages of masks and other PPE, how quick is that turnaround and what's that process like from funding to in hand?
Well, the funding, the emergency appropriation that we passed on March 16th in the legislature, that's been done. It's just a matter of Cal OES procuring the equipment, and there's been a massive supply chain interruption. A lot of N95 masks are manufactured in China. The federal government has come in and the Pentagon has come in and bought up a great number of these things, as well as ventilators. So, we're doing the best we can. I talked to Cal OES's director on Saturday. We had a good 15-minute conversation where I pled our case and urged him to not forget about our area, because we're 4 hours from LA, we're 4 hours from San Francisco, we're two hours or so away from Fresno and Bakersfield, and we have a hospital capacity shortage right now that we need to address, and we need to do it quickly. So we're doing everything we can, and on the local level, our leadership in Santa Barbara County and San Luis Obispo counties are being very creative, trying to source ventilators, source this necessary equipment so we can have more ICU beds from anywhere we can find it, all over the nation and even all over the world.
Can you talk a little bit more about for the relief for small business owners and how what you're doing to help them?
So a lot of that has been funded in the $2 trillion bipartisan stimulus bill that was passed late last week, signed into law. It's going to be, I think there's about $350 billion set aside for small businesses, so they can apply for temporary loans from the federal government at either very low interest rate or no interest. Some of those loans, if you use it to protect your payroll, so if you're able to keep employees on the payroll and not lay them off, you could qualify for a loan that is entirely forgivable with no interest. So we're trying to, in addition to my office, in addition to Congressman Carvajal's office, is trying to get as many of our constituents as we can to apply for those loans as a stopgap measure, so they can sort of get through this next couple months where things are going to be pretty tough.
And what are you saying to the public? Concerns and just fear and anxiety are rising across the board, even though there are these measures in place. What's your message to the public, the community?
Well, I mean, I think the social distancing is going to help slow the curve. It's going to help stretch it out and allow us to play catch up in terms of lining up the healthcare resources we need to handle the anticipated surge. I think all the stay-at-home orders are incredibly inconvenient. They're economically harmful. There's no doubt about that. But I do think that they are going to help us slow the spread of the virus and then be able to catch up. The reality is, about going by worldwide data, about 80% of people that get COVID-19 have mild to moderate symptoms. It's something akin to a flu, maybe. About 20% have more severe symptoms. About 12% need hospitalization, and about 5% or less, will need critical care. So, for most people, but there are sectors of the population, because of pre-existing conditions, age, and what have you, that this virus could be pretty deadly. So, we need to have the resources in place, and I think we're catching up and suffer through this era here where we're sort of sheltered at home. And the sooner that we get onto the other side of the healthcare crisis, the quicker the economic recovery is going to be.
And last question here, I want to touch on testing. We know that, the labs are increasing their capacity to test and results are coming back faster. Can you speak on that in our area?
Yeah, the testing turnaround time has gone down in the last 2 weeks. It was about a 4-day turnaround time from this initial test to getting the result. It's now down to about 1 day. So I think there's a lot of very smart scientists and very smart folks in the medical community that are working very hard on like a home test or different types of tests. And I think we're going to see those resources come online soon. I think that's really going to help because, in addition to more rampant testing, allowing us to direct our healthcare resources to the people that really need it. In other words, okay, you're positive, but you're going to be fine 7 days at home. Try to, lay up and take some Tylenol, drink water and rest, right? There are other people that are going to probably need hospitalization, and the more we can test, the better. And then the testing increase is going to help on the economic recovery as well. Because the quicker we're able to model this whole thing and know where we're at on the curve and know that the number of people recovering from this illness is exceeding the number of new cases and exceeding the number of people that need critical care. That's telling us we're on the backside of this, and we can start reopening sectors of the economy that we've had to shut down temporarily. So testing's critical, and we're doing everything we can, both in Santa Barbara County and SLO County, to get the test kits, to get the reagents, to get the modules for the equipment. And I think we're only going to improve our capacity You look at Germany. Germany's doing 500,000 tests a week right now, and they've had a death rate, a mortality rate from COVID-19 of under 1%. So we've got a good model there to follow. And the more people you test, the more public confidence grows, and the quicker everybody will feel safe going back to work, going to travel, going out to restaurants, and resuming life as we know it.
I know it seems so long ago that we've had that. Is there anything else that you want to add about any more aid coming to the Central Coast or anything specific to our communities here?
Well, in conjunction with our local government leaders and our federal congressional leaders and our state legislators, we have all been working really, really hard on it. There's no partisanship involved in this. We know we've got to catch up on the Central Coast in terms of adding healthcare capacity, but we're doing that. We're fighting for all those dollars. It's being funded at a very high level. I think we're going to see that come online. And I think when we get to the backside of this crisis, I think our economy is going to rebound probably faster than anywhere too. Because the reality is, if you're looking to take a vacation, probably go do some wine tasting or go to beaches. I think there's going to be a lot of people throughout the state and the country that say, you know what, I think going to the Central Coast sounds like a pretty good idea. I maybe would rather do that than go to Disneyland or be in Anaheim or something where people are pretty crowded, right? So I think there's opportunity here in the long run. Once we get past this health crisis, I think all of our economy locally, including our tourism industry, is going to rebound in a big way.
We see that light at the end of the tunnel. All right. Well, thank you so much. I appreciate your time, and that's all I have for you. Unless you want to say anything else.
I'm great. Thank you. Stay safe.
All right. You too.